Dr Philippa Whitford.
Thank you very much, Madam Deputy Speaker. We've all seen the figures about everyone getting older. If we look over the lifetime of the NHS from 1948 to the predictions for 2030, the number of people over 65 will double, the number of people over 85 will have increased by 10 times. And yet the number of funded places for care has gone down by a quarter. So those two things simply don't match up. What we are seeing is that also, as the Minister mentioned, those under 65, those with disabilities or learning disabilities, are also thankfully living longer. But the problem is trying to provide that care. Now, obviously, I tried as a doctor to do my little bit for people living longer, and we shouldn't look upon it as a catastrophe. We must celebrate it. But we're all heading there, so we need to make sure, for our own vested interests, that those services are there for us. We know that a lot of the health you will have in older age is laid down in early years. So we're focusing in Scotland on the Early Years Collaborative, from the baby box for every newborn child, the 30 years early learning entitlement, doubling active transport, and rolling out through schools what's called the Daily Mile. But you don't get a financial return on that for 50 or 60 years. So we also have to invest in our older citizens. While in Scotland we are trying to expand the elective services to meet the demand of hips, knees and eyes, the King's Fund reports rationing of hip and knee joint replacements. We know that 3/4 of trusts have set such strict limits to access cataract surgery that someone is in essence losing their sight and certainly losing the ability to drive. Half of those trusts will only fix one eye. So what we are doing when you do that is we're driving people into their own homes, driving people into isolation, and actually increasing their need for care and the speed and age at which they will need that care. So it really doesn't make sense. Age UK point out that there are 1.2 million people not getting the care that they need. And that matches almost exactly the 1 million family carers who are actually providing a bulk of care for someone who requires that. In Scotland, we have already committed to raising carers' allowance from £60 to match job seekers. But that's pretty paltry for someone who in essence will be working 7 days a week, and 40% of them are reported not to have had any respite or any break in a year. That is because the statutory system isn't supporting them, and it is something that needs to be looked at. What we're seeing is care homes closing because of extra costs brought in by the National Living Wage. And part of that is simply because the price paid is being driven down. As was mentioned, over half of local authorities are seeing either home care providers or nursing and care home providers closing. But the thing is that we need to pay people a decent wage, not the national living wage, but the real living wage. Here. This needs to become a profession that attracts people and retains people. Who is it you would like looking after yourself or your mother? Someone who's only doing it for 6 months till they can get something better, or someone who actually believes in looking after our older population with the greatest love and care and dignity possible? We need to put the funding in. The Minister talked about the Better Care Fund, which has indeed put extra money in, but at the cost of the new homes bonus in England. Well, local authorities are also being told to build more new houses. What is it that they're meant to do? We need to put this on a sustainable footing. We also need to address the issue of those under 65. In Scotland, our programme for government includes the commitment to under 65s in what will be called Frank's Law, in honour of a football player from Dundee who developed early dementia. Because we have people under 65 with the same needs, with early dementia, with multiple sclerosis, with motor neuron disease. Why should your birth date dictate whether you get help or not? Here, here. I will indeed.
Would my honourable friend not accept that while she paints quite a rosy picture of the social care system in Scotland, it has serious problems as well? In my own constituency, I know of one case where a gentleman was in hospital 150 nights after he could have been transferred out because the care package was not there. Freedom of information inquiries have come up with people at 400 nights in care when they could have been transferred. So will she accept that the picture in Scotland is not entirely rosy either?
Oh, I totally accept that the position is not entirely rosy. I've said many times in this chamber prior to her being here that we face the same challenges, which is increased demand, the workforce needs, which will be made significantly worse by Brexit, and the fact that money is tight. So we face exactly the same challenges. And obviously some of those patients that she refers to will have had specifically complex needs that were struggling to be met. But what we're talking about is that we are funding free personal care, not based on means testing. We are working towards providing that for under 65s. And everything in England at the moment seems to be put in to the solution that sustainability and transformation plans will bring. And yet they have been set backside forward, where the budget line is the predominant thing and the designers have to work backwards. That isn't going to give the desired result. And it must also be recognised that supporting people at home and in the community is desirable in its own right. None of us want to be stuck in a hospital. None of us want to be stuck in a care home if we could actually be looked after in our own home. That would be all of our choices. But that will not necessarily cut the money required by a hospital. The nurses will still be there. The lights will still be on. What it might mean is that that bed can be more effectively used and waiting times for surgery or other treatments can be achieved, and they're not achieved at the moment. I saw the issue on the news yesterday talking about the inefficiency of operating lists, and it was clearly said by the former president of the Royal College of Surgeons, this comes down to beds. Beds in England have been cut in half over the recent decades. And the problem is, if you can't put your patient in a bed before or after the operation, you can't do the operation. And that often is only discovered the day before, and you can't just drum up another patient. So we're in a position where there are all sorts of things, not just delayed discharges, which are driving inefficiencies within the system. And the thing that is generating the biggest pressure on the NHS has been the cuts in funding to social care that mean that by 2020 there will be an over £2 billion funding gap in England that has to be met. All of us want to look forward to a dignified older age. We hope that we'll be independent and healthy. We need to invest in that, yet public health has gone down 5%. We also, should we need care, want to have care that is dignified and decent. That has to be funded.